Paano kung may dumating na sakuna sa gitna ng pandemya?
Magandang araw mga kapwa naka-quarantine. Ako po si Howie Severino, journalist at COVID survivor. Humuhupa na raw ang COVID sa bansa nang tamaan tayo ng sunod-sunod na bagyo. Paano magresponde sa kalamidad sa gitna ng pandemya? At may bakuna na raw sa COVID. Kailan kaya ito darating sa ating bansa? Tatalakayin natin ang mga tanong na yan kasama ang UP professor at COVID researcher na si Dr. Guido David at ang infectious disease specialist na si Dr. Edsel Salvana. Kasama natin ngayon si Dr. Guido David, isang professor of mathematics sa UP Diliman na miyembro na ng Octa Research Group na nag-i-issue ng mga reports tungkol sa COVID situation sa ating bansa. Magandang araw sa inyo, Dr. Guido David.
Yes, magandang araw, Howie, and sa mga viewers and listeners ng program niya.
First, Doc, noong Setyembre, inanunsyo ninyo na flatten na ng Pilipinas ang curve ng COVID sa ating bansa, which was good news. No? Kumbaga, bumubuti na yung ating sitwasyon. Ngayon, Nobyembre, flat pa rin ba ang curve ng COVID cases sa ating bansa at bakit mahalaga ang datos na ito?
Ang tinutukoy namin na flattening of the curve, yung active cases. So, kumaga, ang sinasabi natin, pababa na yung cases, yung bilang ng new cases natin. And nagsimula nga siya noong September. Totoo naman na pababa na siya. Kasi nung time na yan, nag-average tayo ng mga 2,000 or more cases per day sa National Capital Region. Ngayon, nag-average tayong 500 cases per day. Biglang lumobo siya nung bandang July to August. Pero yun nga, ngayon, 500 cases per day. So bumababa naman siya. And ibig sabihin, patuloy pa rin yung pag-flatten ng curve na sinasabi namin. Ibig sabihin, pababa pa rin siya. Although ngayon, medyo bumagal ng konting pagbaba niya. Yung mga ibang possible explanation dahil sa Philippine Red Cross, nag-stop sila na testing nung mid-October. Nangyari is may mga possible na backlog na hindi na-test agad at ngayon lang pumapasok yung mga resulta nito. Ang isa pa is dahil sa typhoon, ang sabi nila, may mga laboratories na hindi nakapag-test dahil nagsarado sila and ngayon lang sila nag-reopen. Kaya medyo ang cost nito is tumaas ng konti yung mga bilang ng kaso. Pero ang hindi pa natin nakikita tumataas talaga yung kaso, ang nakikita natin overall, pababa pa rin. Minsan, syempre, pumapalo na above 2,000 yung cases per day. Pero ngayon, ang average natin nasa mga 1,800, 1,900 new cases per day. Ngayon, nagkakaroon ng surge sa Davao City. Ayun ang kinakalapot natin. As in, 3 weeks na siyang tumaas. In fact, sa latest report namin, hindi na number 1 ang Quezon City sa pinakamaraming bilang ng kaso. Ang pinakamarami is Davao City. Ngayon, medyo pababa na sa Benguet pero nagkaroon din ng surge dyan. Hindi lang sa Baguio City, kasama dyan yung Itogon, La Trinidad at Tuba. So nagkaroon ng increase ng cases sa mga yan. Sa Quezon, nagkaroon din ng increase pati sa Quezon Province, pati rin sa Pampanga. So ayan yung mga nakita nating hotspots.
There's a big chance na magkaroon ng increase in number of cases, especially dun sa mga places na highly affected ng typhoon. Actually, right now, we're already seeing an increase sa Cagayan area. Isabela and Cagayan had an increase in number of cases.
Well, just moving on, no? So, I guess it's inevitable naman kung ganito kahaba yung community quarantine tsaka mga lockdown, no? Talagang kahit papaano dapat naman mag-improve, no, yung COVID situation natin. Because these various community quarantines have been going on for 8 months na, no? May nagsasabi, I think we're among the longest lockdowns, if not the longest in the world, no?
Yun yung trade-off natin. Pero I think although talaga nagsasuffer yung economy natin and we definitely want to reopen soon. Malapit na tayo sa recovery I mean, it's almost there. I can almost smell it. Ano, I mean, baka magkaroon tayo ng slight uptick sa December because of the holiday season. Pero we see na, I mean, we agree with yung sinabi ni Yusek Perhere na by first quarter of next year, pwedeng MGCQ na yung Metro Manila. And even now, kahit na GCQ pa rin tayo, yung restrictions natin are very loose actually.
Bakit sinasabi niyo maaring tumaas yung cases ulit sa holiday season? Dahil hindi maiwasan ng mga tao na magkita-kita, magdiwang dahil sa Pasko.
Yes, kasama yan, Howie. Yung pagkikita-kita, marami magsha-shopping sa labas, marami kakain sa labas, magkakaroon ng crowding sa ibang places, sa mga malls, pag nag-sale, pwedeng magpunta yung mga tao, magbilihan. I mean, we don't see na magiging major increase yan kasi marami rin tao na they're careful. Ngayon, hindi pa naman nangyayari yan. Isa pa yung simbang gabi, syempre, we think na baka mag-cause yan ng uptick sa cases. In totality, itong mga activities na hahayaan natin, this could lead to transmission. Hindi naman guaranteed yan. We hope na we're wrong. Pero nasabi natin, syempre, lahat ng gagawin natin, pag nagbago tayo ng restrictions, it carries a risk. Pag nag-reduce tayo ng social distancing, nagkaroon ng crowding, may risk na magkaroon ng transmission. So we hope na yung efforts natin sa protocols, health protocols sa local governments, it will prevent this increase in transmissions.
Okay, maraming salamat sa inyong pagbabahagi ng napaka-mahalagang information. Dr. Guido David, Professor of Mathematics sa UP Diliman at isang researcher at miyembro ng Octa Research Group. Maraming salamat sa inyo, Doc.
Maraming salamat.
Thank you.
Ngayon, mas lumalaki pa ang hamon laban sa COVID-19. Dahil sa sunod-sunod na bagyo, mahigit 300,000 Pilipino ang kinailangang ilikas. Ilang rescue operations din ang naantala, hindi lang dahil mahirap makarating sa mga nasalanta, kundi dahil sa COVID protocols ng ilang LGU. Ngayong may pandemya, paano ba dapat balansehin ang kaligtasan sa kalamidad at sa COVID?
Makasama natin ngayon ang isa sa mga doktor na dalubhasa sa COVID-19, ang infectious disease specialist na si Dr. Edsel Salvana, na isa rin profesor sa UP College of Medicine. Magandang araw sa inyo, Dr. Salvana.
Magandang araw, Howie. Magandang araw sa lahat ng nanonood at nakikinig.
Dr. Salvana, ang laki ng emergency natin ngayon. No? May disaster tayo sa gitna ng pandemya. Mula sa home quarantine ng maraming tao, lalo na mga senior citizen, ngayon na kailangan magsilikas. What is the worst that can happen na kailangan natin iwasan? Anong worst case scenario?
Well, ang problem talaga naman natin dito, yung pandemya nga, it's a very contagious virus. At kung pupunta yung mga tao sa mga evacuation centers, baka hindi nila mapanatili yung physical distancing. Siyempre, nag-evacuate rin yung mga yan. Baka wala silang dalang mask at mga face shields. So I think important na even though alam natin humanitarian crisis talaga to, disaster po talaga siya, we still have to understand na nandiyan pa rin yung virus. At yung virus pwede talagang kumalat lalo na sa mga areas na pangit ang ventilation at areas na crowded. So kung meron tayong magagawang paraan na mabigyan ng mask itong mga evacuees, we can make sure na at least open yung mga bintana para para maganda yung ventilation. And of course, itong mga symptom screen natin, very, very important talaga that we still try as much as possible to maintain the minimum health standards. And so, the LGUs will really have to help them with these measures. We have to make sure the ventilation is good also in those areas. There will be outbreaks. It's almost a given kasi wala pang ang disaster, may outbreak na ganitong klaseng situation pa kaya.
So why did you stress ventilation pagdating sa mga evacuation centers?
Well, what they're really seeing ngayon, predominantly droplet transmission pa rin yan. Although yun nga, may nakikita tayong portion of it that can be from aerosol. And aerosol does happen when there is poor ventilation, especially in crowded places na hindi bukas yung mga bintana. Bumabagsak talaga ang risk ng COVID-19 pag open air or maganda ang ventilation in a place. And we know that the more people there are in the evacuation center and pangit yung ventilation, the more people will be susceptible to this. So very, very important na buksan natin yung mga bintana pag hindi na masyadong umiihip yung hangin, and make sure as much as possible kung kaya mag-physical distance, if people can go out from time to time, i-shift natin. There are a lot of creative ways that we can try to minimize the risk. Kung walang surgical masks, use anything. You can use handkerchiefs, or you can tie a shirt around your face. Whatever, it will have an effect. The effort effort does need to be made, and at some point kasi it's not going to be perfect, but as they say, perfect is the enemy of progress rin in that sense. So instead of doing nothing, we can do something, and then again tulong-tulong tayo, see where we can help out, and do our best.
Okay, sa oras na to, Doc, no, ang dami ngayong sumusubok pumasok na first responder sa Region 2. In particular, yung mga emergency workers, kasama na mga media. Marami dito sa mga responders na to ay galing sa National Capital Region. Alam nyo na mataas ang bilang ng COVID cases sa atin, no, sa Metro Manila. May nagsasabing kailangan i-waive ang mga test at quarantine requirements bago pumasok sa mga probinsya dyan sa yung affected region, para makaresponde kaagad ang mga taong ito na kailangan pumasok doon. Paano natin mababalanse ang bilis ng response sa kaligtasan ng mga residente sa Region 2?
Yeah, well, ang Department of Health actually naglabas na ng advisory noong November 12 pa tungkol dito. At ang sabi nila is, pwede naman ma-waive to, lalo na kung emergency po talaga. But the important thing is, at the very least, merong medical certificate yung taong papasok. Kasi alam naman natin, ang nakakahawa na COVID, ang ay yung mga may sintomas. 90% ng transmission is from those who are symptomatic. So, kung may doktor na tumingin sa isang tao na pupunta doon na relief worker at wala siyang sintomas, then you already take out 90% of the potential to transmit. At yung natitirang 10% na yon, as long as they stick to minimum health standards, at kung magkaroon sila ng sintomas, alisin muna sila, i-isolate sila, I think manageable naman. It's not perfect, pero yung ginagawa nga ng DOH na advisory to make sure at least na yung mga pinaka nakakahawa ay matanggal natin, I think that will mitigate a lot of it. After that, it's really more being vigilant and adhering to minimum health standards. And at the same time, alam naman natin, devolved ng ating gobyerno, so the LGUs understand their risk. Maintindihan rin naman natin na kung isa or dalawang kaso lang doon sa barangay, tapos papasukin mo lahat ng taong to, nakatulong nga sila sa relief operations. Pag alis nila, nagkaroon ka ng malaking outbreak, medyo mahirap nga naman talaga yon.
Okay, some LGUs kasi are requiring testing, no, yung PCR, but some are parang they're settling for the antigen, which is much faster, no? What do you think of antigen testing for first responders before they go into these areas na maraming kailangan ng rescue at tulong?
So, kung titingnan naman natin yung latest natin na omnibus guidelines ng Department of Health for antigen testing, the use of this is really talaga primarily dun sa may mga sintomas at dun sa mga taong nagkaroon ng contact with a known positive case. For screening sa mga taong walang sintomas na walang exposure, it doesn't perform very, very well. Pero alam rin natin na ang sabi ng WHO na pwedeng gamitin ang antigen kung it's a situation na you're not going to get your PCR back in a reasonable amount of time, or kung wala ka talagang access sa PCR. So it's not a replacement for PCR, but it can help mitigate. Pero I think ang pinaka-important pa rin na step natin is yung physical exam, na tanggalin natin lahat na may mga symptoms. Doon pa lang, tanggal na yung 90% ng potential. Tapos yung 10%, kung gusto mo mag-testing, maybe you'll get another 2 or 3% medyo magastos lang nga. And that's the hesitation of people to do that test, because how much will it really add? How much will it take away? Kasi we know our tests are not perfect. Even PCR, may makakalusot pa ng mga kalahati dyan, lalo na kung walang sintomas. So I think that the LGUs really should have the final say in these. We make the guidelines as broad guidance, and of course they can always ask for help din sa regional DOH offices, and may access rin naman sa academe para tulong-tulong tayo. Mahirap po talaga to, walang tamang sagot, walang maling sagot, basta kailangan po talaga we read the situation and we do what we think is best.
Okay, Doc, no, we're suffering from several storms and creating one big disaster, no? From Bicol all the way to northern Luzon, no? So ang daming kailangan na mag-evacuate, and many people are crowding in venues na kung saan nga vulnerable ang mga tao dito sa sakit na to, no? Ang laki na sana ng progress ng bansa natin sa pagsugpo ng COVID, no? We were able to flatten the curve in September. How do you think this disaster will set us back?
Well, disasters are always difficult to work through. I mean, meron na ang pandemic. I mean, everybody just wants 2020 to end after all these things that are happening. So, I think it's there. This is not the first time something like this has happened, the patong-patong. If we go back to, I think, 1991, may earthquake tayo, pumutok yung Pinatubo, tapos meron pang typhoon. So, unfortunately, we still need to do a lot more in terms of preparation. But, we will rebuild. I think the important thing is that the spirit of helping one another is there. We need to really learn our lesson. Kasi yun nga, paulit-ulit na lang to. We have to invest more in prevention measures, in disaster reduction measures, even in pandemic measures. Nakita naman natin na naghahabol tayo at the very start. Hindi mawawala ang disasters, but I think that we really need to learn to better address them para hindi tayo laging ganito na naghahabol.
Okay, Doc, dumako naman tayo sa development ng COVID vaccine, no? Kasi kamakailan na nag-anunsyo yung isang drug company na may 90% efficacy yung vaccine na dinedevelop nila. World record speed, no? Wala pang isang taon. Kayo mismo, no? Sinabi nyo na the fastest vaccine development on record was previously 4 years para sa mumps. Ngayon, less than 1 year, maaring meron na tayong COVID vaccine. Hindi kaya may mga shortcuts sa paggawa ng vaccine na to na makakakompromiso sa safety ng mga bibigyan?
Well, that's why important talaga na yung wala tayong i-shortcut na step. But what we looked at is to yung accelerate natin yung program using things that are still acceptable sa safety. So, ito mga mabilis na pumapasok na vaccines into phase 3 clinical trials are actually based on old vaccines na dinevelop para sa SARS, para sa MERS. So, at least yung preclinical work has already been done. Kasi a lot of that, yung preclinical work na yon, pwede talagang, it can really bog you down yung animal models, mga ganung bagay. The second thing is, pinagsabay-sabay nila like yung phase 1 and phase 2, all the while still making sure na safe yung vaccine. Padami ng padami yan And now with these phase 3s, the way that they set it up is na kung mas mabilis ma-infect ang mga tao, alam na naman natin may hotspot sa Amerika, sa Brazil, the faster you'll know whether the vaccine works or not. Pero yun nga, yung hindi natin shortcut yung observation period for safety. And the earliest thing that we're going to see yung for FDA approval nga sa US is third week daw ng November. At the very least, they'll have 2 months worth of safety data. And that usually is enough for emergency use authorization. And I think, it's reasonable naman yung ginawa nila. Of course, it's not as thorough as if ginawa mo talaga the usual way, but we really, really need this vaccine.
So, paano nalaman na 90% effective na itong dinedevelop na vaccine? Ano bang ibig sabihin nito, Doc?
Well, from what we can gather, kasi hindi pa nila pinapublish lahat ng results ng trial na to. Pero ang sabi nila kasi, 90% efficacy, ang sinabi nila na endpoint nila, ibig sabihin, ano yung sasabihin mo na gumana siya o hindi. Ang ginawa nilang endpoint is how many people develop symptoms that turned out to be COVID. Kumbaga, you take half of the people, bigyan mo ng placebo, which is basically a sham injection, walang active ingredient. Tapos i-compare mo with the other half na binigyan ng vaccine. 2 doses yon. And then you follow them after nabigay yung second dose. And then nakita nila, there were 90% more infections in the placebo group compared to the vaccine group.
But Doc, does not assume parang pareho yung exposure ng dalawang grupo, parehong conditions? Kasi maaring kahit yung mga hindi nagpa-vaccinate, hindi pa rin sila magkaka-develop ng COVID just because marami talagang hindi nahahawa kahit may exposure, di ba?
Right, and that's why yung trial design is randomized. In other words, pag recruit kita, there's a 50-50% chance na makukuha mo yung vaccine or yung placebo. And then you do this randomly para wala kang bias na ito mukhang magkaka-COVID to, ito mukhang hindi. Kasi otherwise kung gano'n, bias talaga. So even yung mga nagbibigay ng vaccine, hindi nila alam kung vaccine or placebo yon. At yung pasyente mismo, hindi niya alam kung vaccine or placebo yon. Kasi syempre kung alam niya na mukhang vaccine yung sa akin, hindi na ako magmamask, okay na. Then magkakagulo rin yon. So the trial design is in such a way na randomized placebo-controlled trial. Ang lalabas talaga doon, ini-eliminate mo lahat ng mga biases. And so kung may effect talaga yung kaisa-isang iba doon sa vaccine group, which is merong active na vaccine, makikita mo talaga siya.
Itong vaccine na pinag-uusapan natin, supposedly 90% yung efficacy, it's an American-developed vaccine. Pero meron din Russian at Chinese vaccines na kung babasahin mo yung balita, mas mabilis pa yung development. Mapagkakatiwalaan ba yung mga vaccines ng ibang bansa at ligtas ba ito?
Well, that's why important talaga na i-publish nila ito at yung tinatawag na peer review sa mga journals. Even yung Pfizer vaccine, kulang pa tayo sa pagkakaintindi kung ano to. Although alam naman natin Pfizer is a reputable drug company. And so based on that, pag sinabi nila efficacious yan, most likely efficacious talaga. The other countries, it's the same. If it's a known drug company. But again, before we say for sure na okay yan, yung mga academics like me, we really need to see the data. Kasi hindi rin naman natin alam kung ano yung mini-measure nila. Kasi ang vaccines, iba-iba rin yan. Meron tinatawag na transmission blocking vaccines na nakakapag-prevent talaga ng transmission na papatay niya lahat nung virus bago ito makakos ng disease. Meron rin yung disease modifying na pwede lang mag-prevent ng severe disease, pero pwede ka pa rin makahawa ng ibang tao. Mild lang kasi yung disease mo. So we don't know those. Wala pa tayong nakikita na final data, and all of that will affect whether this is something that will impact significantly yung transmission ng virus or it's just para mas konti yung mamatay. Of course, we want both.
So kung matuloy itong vaccine ng Pfizer, kailan ang pinaka maagang paggamit nito sa Pilipinas?
Well, ang sinabi ni Dr. Fauci na yung ating dalubhasa na infectious disease sa US, it will be available most likely by January para sa mga frontliners, para sa mga vulnerable populations, and maybe for general use in April. Sa atin, you expect a little bit more delay depending on kasi meron ring logistics in terms of yung sa pag-freeze nga medyo -70, -80 degrees Celsius. So but probably hindi naman ganun kalaki yung delay. And on top of that, kung mapakita na nag-work rin yung ibang vaccines, then pwede pang mas lalong ma-accelerate yon. So maybe a few months delay compared to what the US will be showing. But again, pwede itong ma-accelerate kung gumana yung sa Astra, kung gumana yung Sinovac. The other things about the other vaccines like yung Sinovac at saka yung Astra, pwede mo silang i-store 2 to 8 degrees. Yung sa J&J, isang dose lang. So there are a lot of logistic issues, but we also need to figure out exactly what they mean by 90% efficacy. But the fact na sinabi nila yon, malaking news na talaga yon. Ibig sabihin, we have a shot at ending this pandemic early.
Yeah, pero balikan natin yung sinasabi yung logistical challenges, no? Kasi the research and development part, which has been in the news, no? Parang that's just half the battle, no? There's production, and then of course there's the cost of all this, no? Siyempre kayang kumita yung mga drug companies na yan. And then the distribution in a country like ours, na punong-puno nga ng disaster ngayon, no? We can't even rescue people from rooftops. And it's not just particular demographic groups, no? Eventually we will have to vaccinate everyone, hindi lang yung mga vulnerable groups. So this might take a while, no? Bago talaga umabot yung vaccine sa lahat ng sulok ng Pilipinas.
Yeah, so and that's why we have to be patient talaga. Alam naman natin yung mga low-tech solutions that work. Mask, face shield, physical distance. Right now, nasusustain naman natin yung level of transmission to something that is sustainable below our healthcare capacity while we're opening the economy. So we're hopeful na mangyayari yun. Pero pwede pa rin mag-search. Tingnan nyo nangyayari sa Europe. So dapat very, very vigilant tayo. Pero in terms of, minus 70, minus 80 degrees Celsius, meron kami yan sa NIH where we, na freezers. Pero mahal talaga siya.
Yung National Institute of Health, no?
Yes, National Institutes of Health. You can use dry ice for certain things. Mahirap rin ang logistics sa dry ice. Pero alam mo, if you had told me 1 year before the pandemic hit that we would have as a nation the capability to do 50 to 80,000 RT-PCR tests in a day, I would have told you were crazy. So, alam mo yon, there is a way to do these things. They're not easy, but if it's really necessary, we will find a way.
Sinabi nyo nga, no? This could mean that the end of the pandemic is on the horizon, no? So what does that mean exactly? Can we go back to our old normal and, eat out in restaurants, watch movies, attend basketball games, go to school? Ano ba ang bigyan ng end of the pandemic?
Yeah, well, not immediately. Kasi yun nga, it'll take a while to get everybody vaccinated. And I think that probably there are certain things that we should completely get rid of na naman talaga. That we've seen, this pandemic has really exposed a lot of inefficiencies. For instance, not everybody needs to go physically to work, di ba? Kaya naman pala magiging solution yun sa ating traffic in that sense. Even sa school, the kids don't have to spend the whole day there. That doesn't have to be school every day. So there may be certain takeaways. But in terms of getting back to a semblance of normalcy na pwede tayong lumabas ng bahay na hindi tayo natatakot na magkakaroon tayo ng COVID-19, it will take a while. Even pagsakay ng eroplano, ngayon takot pa rin ang mga tao. I would give it at least a year, I think. Even assuming that the vaccine development continues as it does. Siguro November next year, baka pwede na tayo magkita ulit.
So yun nga, no? We've been reading that it's not clear how long this vaccine will be effective, if it is widely effective, no? So we will only find out kung gaano katagal pag nag-uumpisa ng magkasakit ulit yung mga nabakunahan? Ganun ba yun?
Well, there are ways to monitor that. So yung mga nabakunahan early on, they will follow them and they look at antibody levels, they look at T cells, which is yung T cells, it's a different arm of the immune system that is mas siya yung pumapatay talaga ng virus. Yung antibody kasi nagbablock yun ng virus At bababa yun. Pag kung wala ka ng sakit, like in your case, 'di ba? Wala ka na namang sakit and your antibody levels naturally go down kasi otherwise sayang yung resources na pinapasok ng katawan doon. They'll also look at T cells, they'll also look at how many people get reinfected over the long term. So may advanced data na tayo in that sense. But this is true for all the vaccines in general. But we can see naman talaga na profound yung meron kang vaccine Kasi dati, like for instance sa Amerika, yung wala pa silang polio vaccine, takot na takot mga tao sa during summer. Kasi doon na nagkakahawahan ng polio. So parang summer was a terrifying thing in the 1950s before the polio vaccine. And ngayon polio parang afterthought. Nakakatakot pag may outbreak. Pero they're rare, di ba? So parang ganun. Ngayon takot na takot tayo sa COVID-19. Pero pag meron na tayong effective vaccine, we can get to that point na, okay, it's a scary thing, but maybe 90-95% of people probably aren't gonna get it anymore. So napaka-profound talaga nung meron tayong bakuna.
Okay, Doc, even without a vaccine, no? I mean, the general COVID situation in the Philippines has been improving, no? Na flatten natin yung curve, yung are not is less than 1. There's still many provinces na mababa o kahit isang case wala pa. No? So what can we start doing that we weren't able to do when this disease was new? Kasi dati, we could not do anything. We could not go outside. All the stores were closed, etc. Pero unti-unti nang nagbubukas. No? So what else can we start doing now that the general situation has improved?
Yeah, I think we can start to open up more low-risk areas. You know, people can go to parks, open air, mga activities. Kasi yun nga medyo may health impact rin yun Hindi ka naaarawan, mababa vitamin D mo, walang exercise, magkakaroon ng heart disease lahat ng taong to. So we can start opening up those lower risk activities and within reason nga na people still wear their masks, mga ganon. Maybe we can think about starting up physical school at some point kasi even the kids medyo may mental effect talaga tong nakakulong ka sa bahay. So, you know, pag-aaralan lahat ng bagay na yon. Some of them baka hindi kaya, maybe we can pilot certain things muna para kung pumalya a rollback. Dapat dahan-dahan talaga. Kasi tingnan mo nangyari sa Europe masyado silang maaga nag-declare ng victory. Ito ngayon, nakakulong sila ulit lahat.
Okay, nabanggit niyo yung schools, no? That's really the crucial activity at this point, no? Kasi marami naman commercial establishments nagbubukas na. But schools are crucial, no? And tama ka, I mean, ang laki ng impact sa mga bata. We're not talking just about physical health, no? We're talking about people's mental health, no? Ngayon, wala pang bukas na schools. Would you recommend schools opening again, let's say early 2021, maybe even as early as January of next year?
I think we might think about piloting it, you know, in a place na walang COVID, for instance in Batanes, 'di ba? And see what happens. And do it slowly rather than biglaan. Kasi ang unique sa atin, I mean, the kids themselves, yung risk naman sa kanila is not that high. Pero kasi sa Pilipinas, multi-generational households tayo Baka mamatay si lola or si lolo dahil doon. So we have to really think about it. And we know that children really are drivers of infection. This can really happen. But again, there are ways to do it gradually. It doesn't have to be full school na all 5 days. Maybe they can stagger. Maybe they can maintain all these. Siguro we can start with college muna na alam naman natin at least they're gonna wear their mask, they're gonna physical distance. Kasi pag gawin mo yun sa elementary, baka yung masks nila hindi nasa ulo na or something. So I think that we have to think about all these things. In the end, we might not even do it until we have the vaccine. Depends on how fast the vaccine is. But we have to be thinking about these things kasi profound talaga yung effect sa education ng ating mga bata at sa kanilang mental health at sa mental health ng parents. Ako nababaliw na rin ako sa mga dito sa bahay. Pero I mean, we have to do it because I also have my in-laws here. They're all in their 80s. So we have to be very, very careful. So nandiyan pa rin yung virus. It's very easy to underestimate it pag hindi mo na nakikita, out of sight, out of mind, tapos it'll come back, roaring back na naman. So, yet another lesson for us. Nakita natin nung nangyari sa Europe, kung maging kampante tayo, magkakaproblema talaga tayo. But I think one of our advantages is really we shut down early. And number 2 is we opened very slowly. Of course, may economic impact rin to. I don't want to be insensitive to the fact that people have lost their jobs, their businesses, their livelihoods. But, you know, a lot of those things we can get back. But if you're dead, you're dead. So I think that, yun nga, we've been through a lot. Kung boxing to, siguro nasa round 2, round 3 tayo. Medyo tinamaan tayo pero hindi tayo na knockout. Pero may knockout punch pa rin tong virus na to. So dapat dahan-dahan lang talaga tayo kasi kala natin okay na tayo. Pag tinamaan tayo, baka hindi na tayo makabangon. But at the same time, we have to try to push the envelope rin kasi there's a lot of collateral damage going on from this pandemic. And so, yun nga, we have to find solutions.
Okay, that's wise advice. Maraming salamat sa iyong panahon. And thank you for your service to the country, Dr. Edsel Salvana, infectious disease specialist at isang profesor sa UP College of Medicine.
Thank you very much, Howie.
Sa isa na sa pinaka-disaster prone ng bansa sa mundo, nadagdag pa ang pandemya sa taong ito. Ngunit meron pa rin hindi nagbabago. May mga magsasabing ang Pilipino ay resilient, matibay, nakangiti kahit lubog na sa baha. Tama na ang resilience. Ang kailangan ng Pilipino ay permanenteng solusyon sa matitinding problema. Maraming salamat sa panonood at pakikinig. Ako po si Howie Severino.